You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Here's what's scary. A disproportionate number of non-white children are dying from the virus, according to data released in an internal memo from the Federal Emergency Management Agency. Nationwide, the number of COVID-19 cases among people under the age of 18 from March 1st to August 3rd were 40% Hispanic, 34% white, 40% Hispanic, 34% black, 19%, actually, those numbers, again, I got 40% Hispanic, 34% white, 19% black. I think those numbers are reversed. We need to double check that. The ethnicity breakdown of those patients who died from the disease. Okay, this is who died. Okay, so the first number were those who are under the age of 18 diagnosed. 40% Hispanic, 34% white, 19% black. Those diagnosed. Now, those who have died, 38% Hispanic, 34% black, 25% white. That means that among Hispanics, 40% diagnosed of the deaths, 38% Hispanic. Of those who got it, 34% were white, yet 25% died who were white. So that is, it was a drop. Black people, fewest number of black children diagnosed at 19%, 34% of black kids died. Joining me to talk about the crisis, Dr. Dan, first of all, Dan Fagbuyi, a Pediatric Emergency Medicine Specialist in Maryland and an Obama administration Biodefense appointee. Doc, glad to have you here, Dr. Fagbuyi. This is, to look at these numbers and to see that white children, higher rate in terms of getting it, but the second highest rate who get it, but the lowest rate among those who die, and to see black children, the lowest number who diagnosed, but the second highest number who died. That is shocking.
Yeah, thanks for having me, Roland. Yeah, so the data, we're still learning a lot about the impact on children and the impact on our community in general, both adults and kids. I think one of the studies that's been impactful that recently came out, in addition, was at one of my former institutions where my colleagues there looked at 1,000 kids actually that were referred by actually a physician or because they were exposed to a high-risk target, as in somebody who had COVID diagnosed and was sick, were referred to this off-site, basically a site to get tested. In that study, they actually found that approximately 1 out of every 5 patients actually that presented to that site in the District of Columbia, which represents the DMV area, actually had tested positive. Of those numbers that were looked at, of that 20%, when you break it down of those who were positive, you found that there was a discrepancy in terms of racial and socioeconomic disparity with regards to Hispanics having 6 times more likely to have a positive test as opposed to their white counterpart. And for African Americans, it was children was about 4 times as likely to have a positive test than their white counterpart. So this shows kind of what the discrepancy in the area is. And that doesn't mean that it's just the children. The same disparity data we found in adults. But this has now clarified the fact that we kind of knew this, but it has documented that there are some racial disparities, not just in the adult population, but now is affecting our children. And we need to make amends to kind of fix those things, or at least account for that. Bear in mind that this study also actually was a study that was done early on in the coronavirus pandemic that began. So there were stricter rules in place at this time. So a doctor actually had to refer you to the site, or you had to have the guidelines which were out there, which was like you had a fever, cough, and exposure to somebody who was sick or recent travel. Now those guidelines have relaxed because it's widespread. So imagine if that test was done actually during this time period, we'd probably see a higher, even more prevalence incidence of that case.
The other issue that we're looking at is obviously now all of a sudden school. And
Yes.
now we're talking about in an environment where parents, if the kids go back, parents can't control that. Parents can't look. I have twin nieces, okay, 16 years old, and the reality is, my wife and I, we control who comes in our home. We control where they go. We control who they visit. We control everything about that. Once they leave our home and go back into the school, we can't control another kid wearing masks, whether they're washing, whether they actually practice social distancing. And now we got to completely trust that my nieces are going to say, hey, I need you to back up, social distance, whatever. And now, look, you're now talking about, and a lot of schools are not even prepared to have all of the different things in place when it comes to testing people, checking people. Look, you got a Georgia superintendent, he just suspended a kid who took photos of a packed hallway, and the Georgia superintendent actually said, well, we can't enforce masks. And I'm like, but if you ban kids from smoking, you damn sure know how to enforce that. If you know how to enforce dress codes, you know how to enforce hair length, all that, but you trying to tell me you can't enforce a mask? Come on.
No, real talk. You hit the nail on the head. Those are real issues. All the schools really need to get their act together as best as they can. Now, there are some limitations. Let's just call a spade a spade. And we need to empower your audience and our community in general to be able to know how to make a decision. Am I actually sending my kids to school? I'm a father too. I have 3. And I think that some of the factors are, or that people can actually look at, are test positivity rate. You can look that up. It's very accessible. John Hopkins has a website. You can look at the DC Department of Health, Maryland Department of Health, Virginia, whichever state you're in, you can look at all those online. So your positivity rate should be less than 5%. Ideally, you want it 1% or less. New York is a classic example. Theirs is around 1%. DC is about 1.6, 1.4%, looking at the latest data. But even with those numbers, that will actually at least begin to help you have a discussion around, okay, am I going to send my kids to school? The other part is the school's responsibility, which you alluded to, Roland, which is basically, hey, everybody should be wearing masks, faculty, staff, students. It should be mandatory. If it's not mandatory at any of those institutions, I'm not considering it as a parent. I don't think you should be. I think if that's in place, and then the testing and turnaround time of the testing is another thing. We've had a lot of lag in testing results due to reagents, due to whatever the reasons. There are many things. But now, actually, one of the places that's really been good with really testing is DC. They've improved their testing, but the questions are still the turnaround times to getting the results. Then you ask the school the other question: what are your policies in place in terms of how do you notify families and parents? They're good at being able to notify parents on certain things. So have they done this before? Not all administrators understand the pandemic. They're trying to digest all that information while they figure out what's going on with the children and all those things. But there are certain nuances. So do you have a public health or a health expert or specialist at the school that they've plugged in with, or with the local Department of Health or community Department of Health, and how they can send kids to get tested, or how that all works together? That has to be done. And then what happens when you have a positive case? Do you quarantine just that student? Do you send other kids home? Those things they need to answer and be able to have a plan that's solid in place.
Dr. Dan Fagbuyi, we certainly appreciate it, man. Thank you so very much.
My pleasure.
Dr. Carter, I want to go to you. You, of course, you professor, Howard University. Howard's plan is sort of this augmented plan. They're not going completely online. Talk about that again, how y'all are having to deal with this. And obviously, you're dealing with college students, you're dealing with adults. It's just a whole different ballgame when you're talking about elementary kids, junior high school, and high school.
Well, you would hope it would be a different story, but the truth is we're talking about young people who haven't seen each other for months, who want to be in contact, and you're not going to stop a bunch of college kids from congregating, having parties, and doing all of those things. And I think Howard just came out today with their new plan, which is going to be virtual for undergraduate students and non-residential. And I think that's important. I mean, we all recognize that universities have a desire to get back to normalcy, but these are not normal times. And certainly we want to be able to provide students with the best education possible. I would encourage people to not think of online as some sort of less good variety of teaching. It's just a different modality. Nonetheless, you have to think about the kids first, the students first. And if any of your conversation has an acceptable loss calculation as part of it, we've already failed as institutions of higher education. So I hope more institutions start thinking about these things and thinking about the health of the students, especially because we know that these are young adults. And as much as we want to police behavior, when we think about students with off-campus housing or even on an on-campus environment, we're not going to sit there and lock students away in their rooms and tell them they can't socialize or they can't go off campus and do whatever else they do. And I just think it's a really bad recipe for all the negative outcomes, because we know it only takes one student with a disease that's this highly infectious to make a whole campus community sick. And then it's not just the students, it's the staff that have to clean, right? It's the food service workers. It's all of the other folks who have to come in contact, faculty and others who come in contact with these folks. And this is, universities are just petri dishes and recipes for disaster. I think, what Howard has done and what some other institutions have done is put students over profit. And I know there are a lot of people who would like to be back on campus. They want the experience and they want all of that. But what is the point of opening an institution if you're killing the people that work there and killing the people that you're supposed to be there to provide this education for? And I think, moving to on-campus, in-person classes is just a recipe for disaster.
Look, this is a concern for every single parent, Derek, because look, you don't know. And again, if you talk about already inadequate resources compared from suburban districts to inner city school districts, you definitely about to see that right now when it comes to health.
Absolutely. And, I sat a couple of weeks ago, I sat on a call for the school district for my son, because I wanted to find out what they were doing and all that kind of stuff. And that's where I've really found out what a lot of these different school systems were doing. And again, when you talk about those disadvantaged communities and some of these disadvantaged students, they need the FaceTime. However, given this COVID, we got to do virtual. So I'm dealing with a rising senior in high school, and then I have a daughter who's a rising junior who's part of the University of Maryland College system. And so she's going back in a couple of weeks. And so a lot of their classes are going to be virtual. They're going to do a combination of virtual and in class. So I'm a little leery of the whole thing, but as a parent, I don't know what we can do at this point. I got a niece who just went back to NC State. They're all full board, going straight ahead in terms of what they're doing down there. So each one of these universities, each one of these different school districts, all have different plans. And I think the onus falls back on the parents in terms of what we feel comfortable with and where we feel comfortable sending our child at this point. And right now, man, I'm not comfortable with a whole lot of this stuff that's going on. But I mean, what can we do at this point?
Rob.
Yeah, I mean, we got here, and I have to remind everybody, because we have such poor leadership. Every other country has pretty much came back and responded
on the leadership.
because they dealt with
a global pandemic that happens once in a century.
And so they dealt with it. We decided that we weren't going to deal with it. We decided that we were going to have a state-specific approach, and Trump wasn't going to do anything. Everybody do their own thing. And some people just said, well, we're not going to do it. Some people took it seriously. Some didn't. And so we had we didn't have a coordinated response, and literally lives were lost. But here's the thing. You have all these folks talking about the economy. They've caused more damage to the economy because they had this half-ass opening that they shouldn't have opened. They opened too early. They didn't take precautions, and that did more damage to the economy because now people have less faith. And so when things actually do get safe, there's going to be a lag time, and that's all due to a lack of leadership. And so this is why it matters who's in office. It matters.
I would say, Rob, a lot of that is opinion. A lot of people had to get back to work. So they had to open up the economy because everybody couldn't stay at home. So I think a lot of times when we talk about what's happening right now, we're Monday morning quarterbacking. This is the first time we've ever had to deal with a global pandemic. And so when you start talking about what this administration did and what they didn't do, we also have to remember when this thing kicked off in January and February, every network was carrying the impeachment trials because they wanted to get Trump out of the office. And so I think a lot of people dropped the ball on this thing initially because we were focused on impeachment.
Hold on a second. Why is it that every other nation in the world is able to get through it, but not us?
Every other nation. Every other nation is not the United States.
It's not opinion. It's because we decided that we weren't going to take it seriously. We didn't have a coordinated response. We did not, and that caused lives and that caused economic damage. And you have governors that followed this idiot's lead, and they opened up the economies too early, and they caused a lot of damage to people. I want to make one other point. You said that other people had to get back to work. No, that's a lack of a government response. The response the government should have had, they should have covered workers during this time because the workers didn't do anything wrong. There's nothing they could do. That's what a good government response looks like. We didn't have that.
Rob, everybody didn't want that solution. But that solution wasn't for everybody. Some people want to get back to work. They say,
Dr. Carter.
No, I just think this idea that people don't want it. Who cares? This is a public health event. Who cares what people want? People don't want controls on their guns. People don't want to wear seatbelts. People don't want to do a lot of things that they do every single day. So this idea that we couldn't do anything other than what we did is nonsense. And now we're in a situation that if we'd done what we were supposed to do in February, in March, in April, kids might be able to actually go back to school right now, and parents may actually feel a little more comfort in sending their children out into the world. Some of those same parents who work at those same institutions, because it's not just the kids going back to schools, it's the teachers, it's the school nurses, it's the lunch ladies, it's the counselors, it's the principals. It's a whole ecosystem inside of a school building every single day that makes that place go. So if we had done what we were supposed to do, and it would have been hard, nobody is not saying that it wouldn't be challenging, but it wouldn't be any more difficult or challenging than what we're facing right now, is potentially sending our kids off to get a fatal illness. I don't think anybody prefers that.
Final comment on this. Go ahead, Derek.
I was just going to say it's real easy for us to sit back months later to say what we should have done and what we could have done. And that's what that whole saying. If ifs and buts was candy and nuts, nobody would be hungry. And so it's just easy to sit back and say what we should have done, we could have done, all those kind of things.
Not just in this country, but around the world, telling you what you could actually do to mitigate this virus, and we chose not to do it. So nobody is saying ifs, ands, or buts. The public health information has been consistent for months. We chose to do something else. And just say that and realize we got to live with the choices we did not make.
All right, folks, back to our Roland Martin Unfiltered video in just one moment.
We can face this pandemic head on. We can do what it takes to protect our families and our communities. Together, we can get our economy moving again, but not without the tools and resources we need to get the job done. To win this fight, it is going to take a public service army. Don't let Congress fire the frontline workers who can save us. Text FUMD to 237263 to tell Congress to fund the front lines.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have that you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.